QIBIM artificial intelligence tools will be in the selection of lesions. If we have fewer false positives and fewer false negatives, that will directly impact the patient, because it will mean that we will perform fewer unnecessary biopsies. I mean, that already it directly has an impact. And another very important thing is the time that is dedicated to these studies. That is to say, when we observe a scan that we perceive as normal and QIBIM's artificial intelligence tool has also come back as normal, there is a very high probability that this study will not show any alterations. And vice versa, if QIBIM's artificial intelligence system detects a lesion that would have completely escaped our notice, for example, especially in PIR ADS3 lesions, which are considered to have an intermediate risk. Probably, if we doubt whether the lesion should be mentioned or not, or if it will be relevant, if the tool points it out as a very suspicious lesion, I believe it should be taken into account and probably indicate there a biopsy. I believe that KIPI prostate can help us in in two important ways. One is to select those patients who either because their lesions are very aggressive or because they are very small, but detecting them early can be helpful. It has been statistically shown that it can even help in 10% of detections, even among expert radiologists. And another equally significant facet is precisely the inverse, to endeavor to reduce those biopsies which are genuinely unnecessary, or to detect malignancies that are not particularly aggressive at a very early stage, as this approach would inevitably result in greater iatrogenic harm. Detecting smaller, more aggressive lesions would help us make much more precise treatments, and could also help make more focal treatments for the lesions, also by avoiding, in certain cases, prostatectomies. I believe KIPI prostate can also help improve communication with urologists, because once we've identified suspicious lesions with the help the artificial intelligence tool, it also allows for determining the lesion's volume and identifying it, which could directly help fuse those images with ultrasound and make fusion biopsy much easier. On an important work day, sometimes at 9 at night, when you've reported many studies, it has happened to me once that a lesion went unnoticed. Looking, of course, at QIBIM lesion map and realizing that at the apex there was a lesion that I had overlooked. Well, I believe that just having that kind of safety net, it's already incredibly important.